Well, officials in Houston are saying power outages have hit facilities storing over 8,000 doses of Moderna's vaccine. Some of the doses were distributed to hospitals, county jail, and a nearby university, but shipments are expected to be delayed until at least Wednesday. Here to discuss what the ripple effect could be for the rate of vaccinations in the U.S. is emergency physicians at the Johns Hopkins University, Dr. Gabe Kellen, live from Baltimore. Dr. Kellen, great to see you this morning. If people are in between first and second shots right now, should they be concerned about delays from the storm? I mean, this is a storm that is affecting a large number of Americans.
Thank you. In and of itself, that is not a big deal. With Pfizer, as you know, you have 3 weeks plus about 4 days. With Moderna, you have 4 weeks plus about 4 days. But the CDC itself says if for events like this or unforeseen reasons, you need a further 2 weeks. That's really not the end of the world. That's just fine. Go ahead and get your vaccine a few days later.
I got to ask, we're starting to see more and more people having received the 2-dose regimen of the mRNA vaccines, either from Pfizer or from Moderna. 54 million shots have been administered here in the United States, according to the Bloomberg vaccine tracker. 4.5% of the U.S. population has been given 2 doses. We saw indoor dining open up here in New York City at a limited capacity over the weekend. How should people's behavior shift if they have been inoculated, if they've received those 2 shots? What can they do differently?
Right now, I would stay put because the jury's out. We still don't know whether you yourself, even if you're inoculated and immune, can still carry the virus and transmit it to those people that are yet to be immunized. So you might see somebody elderly or immunocompromised. You think you're fine, but you may still spread it to others. Hopefully that will not be the case, but we haven't shown that that's it. And remember, the vaccine doesn't take in absolutely everybody. So that doesn't mean that you can't become infected and come down with it. Again, the issue is not that you're going to get ultra sick, because getting the vaccine seems to protect against severe disease, but you may still spread it to others. So we don't have a huge long way to go, several weeks, maybe a couple of months, but in the near future, don't do anything all that different.
What about if you have a friend who's already been vaccinated as well? Can the two of you meet at one of your homes and not have to wear masks? I mean, if both people have been inoculated.
Yeah, we just don't know is the truth. I mean, on the one hand, it seems intuitively the correct thing to do. Hey, I'm vaccinated, you're vaccinated. And ultimately, once we reach herd immunity, we're going to have to get back to some reality as to how to live our lives. In the short run, we just simply don't know.
Okay, so I said before, more than 50 million shots have been administered. The vast majority of those are first doses. What do we know about the type of immunity that somebody gets after a first dose of a Pfizer vaccine or a Moderna vaccine, and how long it takes from that shot to actually receive that immunity?
Yeah, so we do know from their trials that somewhere around day 12 or 14, certainly for Pfizer, there's some level of immunity, say 50%, 60%. Moderna wasn't quite as optimistic in their trials when they looked at an interim level, but since then, they also believe that 1 dose confers some reasonable level of immunity, but not the full level of immunity. And the problem with going about your daily life is you may have less severe of an infection or maybe even avoid infection, but it's this sort of mid-level immunity that allows these variants to evade the immune system and select for those mutants that may turn out to be much more infectious and or much more deadly at the same time. So don't go around thinking, oh, I got 1 dose, I don't really need to show up for my second because I'm sort of half protected.
All right, well, lots of questions about the vaccine answered right here. Emergency physician at Johns Hopkins University, Dr. Gabe Kellen, live from Baltimore. Dr. Kellen, thank you as always for your time. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.